talk about it and refuse to be victims. Keep in mind, a lot of the developing countries, there's still a lot of stigma attached to it, and there's still a lot of fear. And just having people say, okay, here are the facts. I was raped, and I've got AIDS, and medicine's keeping me alive, and I refuse to be a victim, is incredibly liberating to women who hear that, to young women. Same thing's true for young men. I mean, I wish that today on World AIDS Day, we had, if I thought of this, I wish we had 100,000 personal stories on Facebook and YouTube and all these websites, you know, just people, and also with men saying, I've got AIDS and it's really wrong for me to destroy women's lives or other men's lives and not behave responsibly. We just need to flood this out there. And in the developing world, it's highly empowering to have individuals. Then I think getting these groups are important. I remember when I was president, I went to Africa in my second term, and Hillary had been working on this whole issue of female genital mutilation. And she started by getting women's groups, and then there was always, every time there was a women's group, there was an auxiliary group of men who supported them. And pretty soon, just because somebody like us showed up and blessed them and they got publicity, they couldn't be punished anymore. They couldn't be isolated anymore. They couldn't be marginalized anymore. I think a lot of this stuff happens not according to some real script, but almost organically it comes up if you can start it in the right direction. And the changing of culture is really hard. And I confess, you know, mostly we focus on just getting out there and testing people and getting them the medicine when they need it and getting the children the nutritional support and all. We ought to talk about that in a minute, both in America and elsewhere. But I've seen this make a difference. And I think it's the only thing that will make a difference, because we all know that people are most at risk of communicating the virus shortly after they get it, when they're least likely to have been tested and found positive. So this is really important that we do this.
Agreed. Kali, I think you wanted to enter this fray.
Yeah, I think it would be wonderful if we got to the point where we could have 100,000 stories on Facebook, but we all know that one of the reasonable barriers to having 100,000 personal stories on Facebook is the stigma that's attached to that, as President Clinton was just talking about. You know, for myself, I also know that as soon as I, you know, tell people that I'm a person living with AIDS at the age of 29 who found out that he had AIDS at the age of 23 after being diagnosed with AIDS in an emergency room hospital with 104-degree temperature, almost losing my life, that there will be a lot less invitations to birthday parties and social events after this, because there is still a stigma attached. Nobody wants to necessarily be associated with an individual or with the AIDS virus, and we have to do something about creating realistic and honest conversations in our country to be able to do something about the epidemic. We have to talk about sexuality. We have to talk about economic and structural barriers. We have to talk about the quality of education and what's going on in our communities and societies, because only when we're able to have those conversations and when we're able to really respond to what's going on the streets of our communities, and when we can respond from love. You know, with all due respect to President Clinton, I think one of the things that we saw during the recent election was just the amount of celebration around the world from a tenor and a message that talked about things that we can do instead of things that we can't do. And I think we need to find every opportunity to talk to people about how we can expand what we're able to do in this country, how America can again act as a leader in the fight against AIDS instead of following, you know, in other individuals' footsteps. How can we step out in the forefront and teach the world how to take control of AIDS and truly eradicate it from our communities?
Go ahead, Virginia.
And to add to what a colleague just said with respect to stigma, there's also a sense of complacency. And we find this to be a tremendous barrier as we work throughout this country in the 12 or more cities where the National Black Leadership Commission of AIDS now have its affiliates. There's a sense of complacency that HIV/AIDS no longer a problem. Part of it is what people see on the television. They see on the billboards. If this person is living with it, they're okay. And all I have to do is take my medication. Not understanding, again, as we know, there is no cure for HIV. So this sense of complacency seems to be allowing or people are more comfortable with having unprotected sex and risking other ways of contracting the disease than perhaps they should be. So we've got to break through that. Also, people don't believe, for example, I was doing a radio show earlier this morning on WWRL, and every time I talk about the 9.5 minutes that CDC states a person will become infected with AIDS. And as I was looking at my watch, I think I've been here at Columbia University for about 90 minutes. So that's probably about, what, about 10 or 9 more new persons who've become infected since we have been in this place today. People don't believe the numbers. The numbers are staggering. So we must do more to talk about it. We must keep it in the forefront. We must do more of getting comprehensive sex education in our public schools, as we are seeing the increase of sexually transmitted infections among younger people. We must talk about sex. And I think the role of the black clergy is playing in all of this is really making a difference in many of the cities where we are working.
One of the things which is true of the United States is that, and my country of Canada, is that there are very, very few children who are ever infected. But in the world at large, the reality of the need to treat children and the hundreds of thousands of children who are born HIV positive still every year, we haven't really talked about children. And one of the things that the Mailman School did, Wafa, I remember that when Alan Rosenfield was dean, the emergence of the PMTCT Plus, the Prevention of Mother-to-Child Transmission Plus, where the focus shifted in significant measure to the mother, something that the world had paid little attention to until that moment. Wafa, we're still seeing this terrible number of kids infected year after year when the intervention through drugs should be pretty easy. Do you want to just discuss that? We haven't talked about children.
Yeah, I think it's one of the, I mean, there have been a lot of advances over the past several years, and I think we need to really celebrate them. I think we can't forget how much progress has happened. But in the arena of children with HIV, we have a ways to go. And I think it requires, and what we've tried to do at ICAP is reconceptualizing the whole concept of how mother-to-child, prevention of mother-to-child transmission should be done by thinking of the mother, by thinking of the family as the unit of action, and shaping the interventions and shaping the programs so actually it can be a family approach, so that women, pregnant women, can come into care, into antenatal care, get the attention they need, get tested, get the care they need for their own health, as well as to enable protection of their children. But nonetheless, I think in many ways, we fail to make the connections that every single woman, every single pregnant woman gets tested, every single pregnant woman gets the care she needs, and every single pregnant woman needs to take what protects her child, and her child needs to get access to the treatment that they need. And that's where I think we need to continue to mobilize the resources to be able to reach literally millions of children at risk or infants at risk without having this enormous expansion of programs that are focused around prevention of transmission. I think it has to, in many ways, unfortunately, we've thought of prevention of mother-to-child transmission as a little island by itself, and we have to bring it back into a holistic approach of comprehensive care to families with HIV. And maybe if we put it into that framework and bring it into the mainstream of HIV programs, we actually might be more effective in reaching, in prevention new transmissions, but also in bringing children who are already infected to get access to the treatment, thanks to the work of the President and his foundation in providing access to those treatments. But I do think that it's going to require a concerted effort, and there are lots of partnerships, new partnerships that are happening around the world to try to help in reconceptualizing protection of children and protection of families.
I want to make a quick confessional so I can sleep tonight. The people with whom I work do not use prevention of mother-to-child transmission. I'm using it because it's an easy phrase. We use vertical transmission because we refuse to demonize the mother. Nobody ever asks who infected the mother. So when you say mother-to-child transmission, you're immediately demonizing women, which is a